What first brought me here was a period of time that I was very unstable. I was homeless for about, almost 9-10 months at that point. And I was in and out of sobriety. When homeless, I lived with a friend in a boarding house, a rooming house. That was really not a good place to live. It was full of drug dealers. I wasn't taking medicine. My depression was coming and going. And then I had a crisis where I came into acute services here. I was from there sent to the emergency room. And in hospital, I was referred here to CMHC by YPH.
When I first got ill, I was a single mother. I had 5 children. I went through a period where I worked round the clock doing CNA home health aide work for like 2.5 years, and it still wasn't enough. I mean, I needed more money, and I needed more support, and I didn't have any of that. And when I had my breakdown, that was when I started to hear the voices. That's when I started to see things on the walls. That's when I started to hear, like thinking the TV was talking to me, and everything was just changing all the time. I just knew something was really, really wrong, and I just came straight over to CMHC for help.
Between 20 and 30% of the general population in the United States has either a mental illness or a substance abuse disorder or both. What we find in the majority of the people who come to the Connecticut Mental Health Center is that their lives are profoundly affected by the mental disorders or the substance abuse problems that they're suffering from. And that's one of the principal reasons we're here, is to work with people about improving their quality of life. Hope is the most important thing. With hope, amazing things can be accomplished. CMHC is organized in a unique way within the state of Connecticut, in that it is a community mental health center that is run by the Yale University Department of Psychiatry for the Connecticut Department of Mental Health and Addiction Services. The Connecticut Mental Health Center we think of as having 3 missions. First, clearly, is clinical care, but we also have very important missions in research and education.
CMHC, it's a unique place. I've been very fortunate to be able to come here as a trainee. CMHC provides a wide range of clinical services and houses also a number of research programs that are led by authorities in the field. So I think this is a unique opportunity for trainees to come and see how things work and receive the highest quality of training. Approximately
5,000 people a year receive services of one sort or another throughout the Connecticut Mental Health Center. Those services are provided by approximately 550 staff. The way I think of the population that we serve is that we are here for people for whom there would be no other services available.
When I first arrived, I had no money. I had no insurance. I went through the acute services procedures, and then once you're processed, then and you're eligible for outpatient, then you go up to the 2nd floor. They assign a clinician to you and all that, and then they help you get your medications and everything progresses from there. I was given this prescription. They told me to bring it to you.
Okay.
How you doing?
Good, how are you?
Good, and you?
I'm all right. Well, once I was assigned a clinician, very soon after, then I was assigned to a psychiatrist. Soon after, I was assigned to a group therapy, a support group, and it was basically talking about, I guess, sobriety, relapse prevention. It's valuable to me just to hear what other people have been through.
At CMHC, we provide clinical care largely in the context of treatment teams that are interdisciplinary in nature. They tend to be fairly large and have good representation from psychiatry, psychology, nursing, social work. We often have occupational therapists, rehab therapists, employment specialists, and a variety of trainees from various disciplines. All those people work together in collaboration.
As a psychiatrist, my role is to oversee this integrated treatment and specifically to help with diagnosis of their condition and treat with pharmacologic measures, namely medications. We just want to talk just briefly about that because Serena is on clozapam, and I believe she has gained weight on it in the past.
It feels really great to have a lot of people working with me. Team E, everything that I need help with, somebody's there. There's an actual physical body, person that is, is dedicated to helping me solve that problem or whatever. And I just love it. I love it. You can't help but feel good.
Our community mental health center helps people develop hope or nurture hope, primarily using the recovery-oriented model.
The recovery model is meant for clients to achieve their goals and dreams for how they would like their life to be. So actual treatment of the symptoms of their illness is only a small part of it. The rest is towards how they can improve their functioning with the illness they have, and how can they be more productive and find jobs in the community and access other resources and try to lead as normal a life as they can.
And each coin is worth $5?
Each coin is worth $1. So you gave me a voucher for 5, and now I'm giving you 5 coins.
Okay.
Within the outpatient rehab department, we offer a variety of services. We focus on community integration, take a look at self-care, independent living skills, building social support networks, really helping someone improve their quality of life.
I've been working with Ann Joy over the last few years, and she's really great. She helped us start a diabetes group. We have exercise group. I meet twice on Monday and Tuesdays. I also do vegetarian cooking. I learned how to cook things that I wouldn't ordinarily think of, and I'm realizing how healthy, it is.
Serena could be the poster child for rehab services. She's been amazing. Whatever she feels will benefit her, she initiates and she perseveres. She's been truly amazing.
So, good for you.
It's working,
And I bet the exercise, really actively participating in the exercise.
I haven't lost
really
weight,
helps.
but I've lost inches.
That's important.
Yes.
That counts.
Yes.
I've been an artist, but I sort of had a dry period. I wasn't doing much. But my clinician at that point recommended an art therapy group. Well, I find the art therapy, it's a unique way of just engaging your imagination and your mind. So, my mind races quite often. That's one of my symptoms. But it allows me to focus and channel. And just really, it's a very mindful experience. We have a courtyard now with a new addition of the West Building, and we're working on it to make it a healing garden. I also have another project where I'm working on one of the tall windows in the courtyard, and so I use cut vinyl, which I make in my own shapes. It's kind of an abstract flowerscape. It's a great way to sort of exhibit my art publicly, plus it's a contribution to the garden.
In terms of how to implement.
The community service network is a critically important element to the work we do at the Connecticut Mental Health Center. It is most easily described as the community nonprofit partners throughout the greater New Haven area that we work with.
Through one of the agencies, Continuum, I received a rent subsidy, which was really an interim until I went to Shelter Plus, which is administered also by the CSN. Having my own place has been great. I'm never going to leave my place,
And I think you've got a great apartment over there. I hear you've decorated it beautifully with all your artwork.
Yeah.
Anything else?
No, that's
125, please. Right now, I work in Park Street Bistro, is what we call it. It's on the second floor in the CMHC building. I'm at a level now where I can branch off and do something else. Let somebody else come up that that really needs a job for rehabilitation purposes. The job coach is important to me because it's really hard, especially nowadays, to find a job. And she works with me. She helps me with my resume. We go out to job sites together, and she's just really good with me that way.
Do you have transportation to get there?
Can I meet you here?
Of course, you can meet me here, and we
That
can
would be
see
great.
if somebody else wants to go with us, and we can take a couple people to the job fair and definitely do some job developing there.
Connecticut Mental Health Center Foundation is an extraordinarily important partner. The principal reason is that the foundation has a way of funding projects that could not be funded were we to be solely dependent on state money. 2 years ago, in partnership with the foundation, we approached City Seed and were able to place a farmer's market on our parking lot, and this was done with foundation money. The foundation's been able to act in very creative ways And examples of that are internships that the foundation will fund.
Well, through my work with one of my clinicians, she made me aware of an opportunity, which was an internship that was for somebody receiving services from Connecticut Mental Health. And this was for an assistant art curator. 3 weeks later, I was called in, and I was very excited. The internship was originally designed for 4 months, but it was paid. It was a real job. So that was over 3 years ago. Hey, Winter.
Hi, Steve.
How you doing?
I'm good. How are you?
Good.
So Steve was our first intern, and we wouldn't let him go because he's just become a wonderful asset to the Arts Council and now assist with all of the various exhibition venues that we have.
Yeah.
Finished.
A little bit
It's
of challenge.
wonderful.
Well, this wall
Yeah.
is done anyway.
I mean, I think the focus on recovery is vital, and fortunately is a cornerstone of the services that we provide here at CMHC. I think the goal is to assist clients in finding purpose in life. I think that's what helps people manage and overcome severe mental illness, and I think Steve is a good example of that.
Part of my symptoms were for many years with the depression when I was unmedicated. I was absolutely isolated. Doing the socialization with my anxiety, it was very hard at first, but it's slowly I get more and more engaged. So it's had quite an impact.
One of the most important ways of thinking about the impact of untreated mental illness and substance abuse is in terms of the economic impact on our society. It's not the only way, but it's a very important one. Just about $190 billion a year are lost in wages and productivity from people because of serious mental illness and substance abuse.
One of my old psychiatric clinicians, he gave me the idea that I could do anything. I don't have to be a blob. I don't have to be a zombie. That I could really do this, and that's when I went back to Gateway after being away for many years. I went back and I got my 2-year general studies social science degree, and then after I graduated, I went back again the following fall and started taking nutrition classes. So now I have maybe 3 more classes to go, and I have my nutrition degree.
Serena contributes greatly to the Haven community by being a good citizen, a model citizen, someone that just won't stay as she is. She's looking to grow, to improve, to have an impact on herself and others. And I think she's achieving that every day.
And every day at CMHC, you see examples of people who've accomplished amazing things. And who wouldn't want to work in a situation where every day you get to see successes and you get to see victors? And that's what makes this such a wonderful place.
The possibilities are crazy. I could do anything. I can be anybody. I can go anywhere. And I don't have to sit on the sidelines. I can be a part of life. And I just want to be able to contribute something. I want to be an asset to the community. I don't want to be a liability.